Hi, everyone. Welcome to Vitaboom's webinar with Transformation Enzymes. We're going to be talking about the truth about enzymes, debunking myths, and discovering the transformation difference. We're just going to give 1 or 2 minutes to allow for other people to attend, and then we'll get started in just a short period of time. So sit tight, and we'll be back in just a minute or 2.
I don't do well with silence, with long bouts of silence. It's so awkward.
Well, I'll give it like
No, you're fine.
Okay. So, Amy, why don't we get started? All right, so we'll get this webinar started. It is being recorded, so you will all get the recording after the webinar is over. It'll be emailed to you. And I'm really excited to introduce Amy Rawls. She is a registered dietitian nutritionist who uses an integrative and functional nutrition approach that focuses on root cause resolution and mind-body optimization. Amy has been in practice since 2010, and she completed her master's degree with a dietetic residency through Lamar University. Amy's gone on to earn additional certifications as a functional medicine nutritionist and a certified gastrointestinal nutritionist and certified enzyme therapist. Currently, she is the Director of Clinical Services and Education for Transformation Enzymes, where she's responsible for all of Transformation's education, development material, programs, and annual seminar. She also oversees Transformation's clinic and technical support services and assists with research and development. She has spoken at various events and seminars and conferences around the US and internationally on topics related to nutrition and enzyme application. Her passion for using nutrients and food as the foundation of treatment protocols, combined with enzyme therapy, is supported by up-to-date scientific research for a functional integrative approach to healing the body. The Vitaboom team is very excited to have Amy and Transformation Enzymes here today. Obviously, we have Transformation Enzymes in our Vitaboom catalog so that you and other practitioners can add these supplements into your client's personalized daily packet protocols. So now I'm going to turn it over to Amy, who is going to educate you all on the benefits of enzyme therapy. Amy, all yours.
All right. Thank you so much, Deborah. And thank you guys again for having me. It's such a joy to work with you guys. I just love your company and all the convenience that you guys offer as a different alternative for those of us that want a more individualized approach to our supplement recommendations. So again, thank you guys so much for having us, and we're so glad to partner with y'all. So that being said, as a partner, we want to make sure that all of Vitaboom's customers have a really clear understanding of not just Transformation's products, but enzymes in general, because when it comes to enzymes, there is a great deal of misinformation and myths about these delicate life-giving substances. So in today's presentations, we're going to discuss the common myths and address the frequently asked questions regarding enzymes, as well as how to navigate which formula that Vitaboom offers through Transformation might be best for your clientele. So let's get started. Okay. So just, again, a quick debrief on who Transformation is for those of you that might not be aware of our company. We are founded, owned, and operated by clinicians. That's actually what drew me to Transformation in the beginning. We were established in 1991 by Dr. Dickie Fuller, known as the mother of enzymes, and we are the pioneers in enzyme therapy. We specialize in the development of high-quality digestive enzymes, systemic enzymes, probiotics, and enzyme-delivered nutritional support products, which we'll be discussing later. We have clinical applications with educational resources, as well as proven protocols throughout our almost 40 years of being in practice. We have accessible technical support. This is probably one of our most unique selling points, is our technical support that we provide, as well as our clinical services and our customer service as well. We are small, but we are mighty. So we're not a big conglomerate. We have a small team, but what I love about that is you're always going to get a live person on the phone, and we truly think of all of our practitioners as well as partners as family. So that's something I really like about Transformation. We also meet and exceed industry quality control guidelines as well. So, a company can be one of three things. They can be the best for quality, the best for convenience, or the best for price. And we really, strive to be the best when it comes to quality. And with that, price would be our second strength, but quality is where we really strive to shine when it comes to our product line. So the transformation difference, that when I talked about quality, we have not compromised like some of our competitors have with the addition of additives and flow agents to help manufacturing be easier. That's part of why our price points are where they're at, not to mention the quality of the ingredients we select, but we do not use any fillers, additives, or unnecessary ingredients. Our enzymes are in every product we carry, even if it's not an enzyme product, and that is to enhance the utilization of the additional ingredients in that product. We also have products designed to be tolerable for those with allergens and various sensitivities. All of our products, with the exception of our glandular formulas and our essential fatty acid formula, are vegetarian. We also provide detailed product training for proper application of our products, as well as advanced clinical support from me and the rest of our education team. As I had mentioned, we have proven protocols to simplify your practice. And probably the best thing about Transformation that makes us stand apart is our 30-day money-back guarantee that we offer. So those are just some unique things about us. Now, let's get into the meat of today, which is, what are enzymes? Why do we need them? Let's debunk some myths and facts. So what are enzymes? All enzymes are energy-rich proteins that occur naturally in all living things, and they are critical for life. So your ability to move, see, hear, taste, think, it all depends on enzymes. They control literally every metabolic process and biochemical reaction that the body is going to have, from simple digestion all the way down to very complex immune responses. So every organ, every tissue, plus 100 trillion cells in our body depends on enzymes. So if you're using as a primary in your practice vitamin and mineral supplements, guess what? Those require enzymes to work. Vitamins and minerals are coenzymes, and without them, without the enzyme piece there to facilitate their absorption, their efficiency is not as good. So the benefits of enzyme therapy. I was not always an enzyme therapy practitioner. I actually didn't start utilizing enzyme therapy in my practice until 2016, 2017. And I've been in practice since 2010. So it was not my first line. It's not something I learned about in school. It came much later. I wish I had learned about it early on. But the reason I switched is because within 1 week, I saw the drastic changes in myself as well as my clientele. And I really shifted my approach to how I was, developing my protocols for the different conditions I was working with. So the different benefits of enzyme therapy is they support the body nutritionally with enhanced digestion for more efficient nourishment of the cells. That's pretty obvious, but they do a lot of other things. We have tons of webinars that are discussing the benefits of enzyme therapy outside of just digestive support, because enzymes are not just for digestion. Systemic enzymes in the form of proteolytics are phenomenal at helping with the reduction of inflammation. They also enhance blood rheology. They modulate the immune system. They support detoxification, which we're going to talk about a little bit later. So they really they do a whole lot of things. And that's where the simplification comes in, because with one or two products, you can achieve about 7 different actions that the body's going to need to function optimally. So they are, safe and also simplify what you're doing. Now, when it comes to enzymes, there are 3 main sources, okay? So there's either food enzymes that you can get from raw food directly, if it has not been cooked. There are digestive enzymes, and then there are metabolic enzymes. And we get these questions a lot if, we carry these specific metabolic enzymes. Metabolic enzymes are produced endogenously and cannot be supplemented. These are enzymes like the 5-bioidenase that converts our thyroid hormone T4 and T3, or the 5-alpha reductase metabolic enzyme that converts testosterone to dehydrotase, then to the aromatase, that enzyme for the estrogen aromatization. We don't supplement with those. You can't supplement with that. But here's where digestive and systemic or supplemental enzymes will fit in. Metabolic enzymes are responsible for all the chemical reactions of our body to sustain life, but the building blocks and the cofactors necessary for those metabolic enzymes to do their work, guess where they're supplied by? They are supplied by the work of digestive enzymes. As a matter of fact, the amino acids made available to the cell for the synthesis of the metabolic enzymes themselves are supplied by the activity of digestive enzymes. So as you can see, the importance of the digestive enzymes are just as big as the metabolic. So we don't directly supplement with them, but we do use the digestives and systemic to help facilitate the production of natural metabolic enzymes. So an enzyme therapy overview. If you're new to enzyme therapy or kind of getting into it, or maybe you're well versed in it, but you're only working with one form. There's different forms of supplemental enzymes. There's animal derived, fungal or microbe derived, and fruit derived. Okay. Now, animal enzymes are a form of supplemental enzyme that comes from the pancreas of an animal. So we make enzymes too via the pancreas. But when you're getting them in supplemental form, they're typically coming from like an ox or a cow or some animal. So for instance, pancreatin comes from the pancreas of a slaughterhouse hog or ox. However, when it comes to animal enzymes, and this is what I don't think a lot of people realize, their best work is not for digestion. Their best work is in an alkaline setting for the blood, but not really for digestive purposes. They're also typically not recommended for pregnant women or children because they have to be enterically coated. This is why they don't work in the stomach. They are not able to withstand the harsh pH of the stomach and more acidic pHs of digestion in general. So they have to have that enteric coating so they're not destroyed. With enteric coating comes excipients. We don't like that. I'll talk more about this in a minute. Now, that's animal, right? Fungal or microbial enzymes are grown on plant foods as their host in a lab where they are fed to become whatever digestive enzyme is required. However, they do not contain their host. The host is a plant source, and it is used just as a platform to host the mycelial or biochemical enzymes. Enzymes cannot be made like synthetic vitamins or minerals. They have to be grown in plant form and extracted without chemicals in a laboratory process. That's how fungal and microbial enzymes are created. When it comes to plant enzymes, that's the fruit derived. Those, like it says here, are going to be harvested from part of the plant itself. But plant enzymes have the ability to work throughout the entire digestive process as well, from esophagus to rectum, and do not require enteric coating. Plant-based enzymes are harvested and have the ability to aid digestion through that entire process. And some of the common ones that you'll see and what we actually use in transformation formulations are bromelain, which comes from the stem of the pineapple, and papain, which comes from the papaya tree. So I'll talk more about why plant and microbial over animal in a few more slides, but that's just the gist of the differences. Now, when it comes to reading the label and knowing what you're looking at when looking at an enzyme product, if you've looked at enzymes before and you're using one that lists the activity, you might be thinking like, what the heck are these numbers? I've never seen these before. Because what we're used to seeing is milligram, IU, DL, these different vitamin and mineral measurements or even weight measurements. Enzymes are not measured by weight at all. The gold standard for determining and measuring enzyme activity is what is called the Food Chemical Codex, or FCC. FCC units establish activity levels and procedures for determining enzyme potency. Weight measurements are not appropriate since there is no direct relationship between weight and the units of activity. So when people call in asking me to compare a product that they're currently using to, for example, one of our digestives or a different formula we have, when you send me a label like this, I can't really compare because I have no idea what the activity is of the enzymes listed here. And so we do list our activity, and that is one thing we've done to maintain the transparency, which falls under our quality standards that we strive to keep up. However, the problem with us being so transparent allows our formulas to be copied. So whether or not we keep it this way is to be determined. But you know, it is what it is. We chose to just be transparent with what we put in there. But that's what this is. You really want to look at the FCC. So like here you see it says Propriety blend, 500 milligrams. Okay. That means nothing to me because the weight could be there, but the activity could be completely gone. And this is really why I think when a lot of people take stuff that they've bought either over Amazon or even from a competitor that has great products, but their bread and butter might not be enzymes, they don't see the same clinical effects as when they try one of ours. Because one, there could be when you don't list activity, you're also not required to meet that activity at the time of expiration. Because we are listing activity, that means that at the time of expiration, we have to hit that, okay, which puts more pressure on us, but it's better for the customer. So those are just some things when it comes to the quality to keep in mind too, because a label like this, all of the cellulase could be gone and there couldn't be near as much, there could be less than what it initially started with, but because they don't list the activity, they don't technically have to meet a specific amount. So hopefully that makes sense. But the reason you want to look at activity is because I can see this comes into as well as, well, what enzyme to use, right? So for example, this is the label for our digest. It's our strongest digestive. Let's say you're working with someone that doesn't have a gallbladder, or maybe they're on a keto diet, or maybe they just really need help with digestion or more help with digesting fats. I don't know how much lipase is in this formula. Where is lipase even on here? I'm trying to find it. I don't even see lipase here, so I wouldn't go with this one anyway because it's not a complete digestive. But if it had it and it didn't list the FCC unit, I can't compare to see if it has the same amount of lipase as what we carry. I can tell you most don't, right? So you just know that. But that's just an example of why we like to have that so we can kind of see what's there. And then you can also see here, if you look at our ingredients, we really, like I said, work very hard to keep excipients out because we work with the chronically ill. And any of the supplements you guys are using, if you're constantly loading people up with magnesterate and, talc and these different additives that have to be put into a capsule or put into the capsule as a flow agent in manufacturing or even in a tablet to keep it stable, those are still excipients that could add to toxic burden. So we really try to keep that out. So even looking here at the ingredients, you can see the difference that ours is much less as well as for the non-therapeutic parts of it. All right. Okay, so enzyme specifications. When it comes to enzymes as well, not only are they measured differently, but you keep hearing me say stuff about activity, right? So enzymes have a certain pH where their activity is going to be maximal. At higher or lower pH values, their activity will decline. And the enzyme concentration is the amount of enzymes present in a medium. If the concentration is low, then the activity will also be low. So we actually focus a lot more on this in our Enzyme 101 course that I'll be talking about a little bit later when it comes to education offers we have. But in-depth explanation there. In a nutshell, this shows you all of the different enzymes that Transformation uses, the sourcing of them. So we specialize in mycelial and plant enzymes. We do not use animal, and I'll explain why in a moment. And this shows you the effective pH range in which the enzymes work. So as you can see, we cover digestion from as low as a pH of 2, all the way up to a pH of 10 or 11, right? So which the average pH of digestion is going to be around 3 to 8, I believe, through that whole process. So we have you covered all the way through. When I've looked at other formulations, specifically digestive ones, they might just have some amylase in there for starch breakdown, but we don't just eat starch, guys. We need lactase for the milk sugar, for lactose. We need our beta-glucanase. We need diastase for other simple sugars and breads. We need cellulase for fiber, hemicellulase. You can't get these from eating raw either. So just having amylase isn't really giving you a full rounded digestive support that you would need for the typical diet that someone's going to consume. So as you can see, we have all of that covered there. And when I look at some of our competitors, they'll have, for example, protease 6.0 or bromelain as their proteolytic to help support digestion of protein. That ain't going to work. It will help a little bit, but what you really need for digestive support when it comes to proteins is you want acidic proteases. So you need to make sure your formula has a protease 3.0 because look at the pH range that it works in, much lower. Versus bromelain, it really doesn't get kicked until around 6. The stomach isn't a 6. The pH of the stomach is not 6. So that means that bromelain really isn't doing much in the stomach. So we know protein digestion and the synthesis of B vitamins begins in the stomach. So why would we use a proteolytic enzyme that isn't going to do anything there? This is where, working with companies that specialize in enzyme therapy like we do is really going to makes the big difference in the synergy of our formulations. So just something to keep in mind. So another really common question that we get, we're kind of getting into the FAQ part now versus kind of just some enzyme facts. Common one is, do supplemental enzymes stop the body from producing its own enzymes? The answer is no. Pancreatic enzyme production is not controlled through feedback mechanisms. So oral enzymes are not sensed by the pancreas. In fact, what we've actually seen is when you supplement with digestive enzymes prior to a meal, it actually increases elastase and increases the exocrine pancreas output. And we see improved digestion that way. So it actually makes the pancreas work even better. The body is going to continue to manufacture enzymes even with supplementation. All the supplemental enzymes doing are supporting organ function without replacing its effective working ability. They simply aid the digestive process and lessen the burden on the pancreas, improving natural output. If you want to see the research on this, feel free to reach out after today's webinar and I can get that to you. Another one is, do digestive enzymes break down healthy tissue? This is obviously a no, but it's not a stupid question, because if you think about it, if you take a protease, it breaks down protein. Is it going to break down your muscle, right? If you just break it down that simple, then that would make sense, but it's not that simple. So enzymes help to debride dead and necrotic tissue. They do not attack or destroy healthy living tissue. So if it is an intact cell membrane, the enzymes are not going to break it down or degrade it. Enzymes are also not random. They have specific jobs or substrates that they work on, and breaking down healthy tissue just simply is not one of them. Can I have an allergic reaction to digestive enzymes? Well, as a purified protein isolate of a fungal organism, allergic responses are not impossible, but they're really, really rare. Enzymes do not cause immune reactions as they are carried on a protein carrier called alpha-2 macroglobulin. Alpha-2 macroglobulin is not foreign to the body. The immune system recognizes it. So it's this little basically casing that grabs the enzyme and carries it through. So as it's going through, the immune system's not alerted to anything, which that's typically how an allergic response would happen. Even with an aspergillus sensitivity. So if you're doing food sensitivity testing and aspergillus is flagged, guess what? The enzymes themselves, like I said on the earlier slide, with the creation of the microbial enzymes, it does not contain the host, okay? It does not contain the actual species and should not cause a reaction. So case in point, we did a case study a while back on a woman who suffered from collagenous colitis, and she had been suffering with chronic diarrhea for 15 years, had tried all kinds of supplements, nothing would work. The allopathic side didn't work, the holistic side wasn't working. She did an ELISA act, and it showed she was highly reactive to aspergillus. However, knowing what we know about the enzymes and the way they're carried through the body and what the root of her sensitivity was, the root of all food sensitivities, guys, is poor digestion to begin with. So we knew we had to get her digestive system functioning, and then that sensitivity would correct itself. So with this specific woman, we placed her on our gastrozyme product, which has the aspergillus strains in it. She not only tolerated that product beautifully, her diarrhea for the first time in 15 years stopped within 1 week. So that's just kind of proof there that, the allergic reactions aren't really from the enzymes themselves. And to get to the root of it, you still have to hit digestion. Are enzymes safe since they are derived from mold? So I've mentioned that ours are from aspergillus species, and we work with plant. But this is another one that kind of gets a negative reaction when they find out that we use aspergillus, right? Because that's a scary word to a lot of people because of the mycotoxins. Aspergillus flavus and Aspergillus parasiticus are responsible for producing mycotoxins. Only safe, non-toxigenic strains used by TEC are used, and that is going to be the Aspergillus oryzae and Aspergillus niger species. And even after an organism is determined to be safe and is used in fermentation, every second generation is again checked to verify that mutations have not occurred, which might enable the organism to produce mycotoxins. So in our 40 plus, almost 40 years and 50 years of Dickey working with enzymes, we've never had a mycotoxin instance. Enzymes have been used for centuries without any reports of mycotoxins. So we deem them safe of that. Why do we use mycelial instead of animal? So this is that question I mentioned earlier in the presentation. We don't want any animal byproducts, period, because that comes into sourcing and the health of the animal. As I'm sure you guys are aware, the health of livestock in the US isn't really always the greatest. And then there's also manufacturer availability. You can have the most beautiful formula and go to the manufacturing trying to get that formula made, and guess what? They might not have the ingredients that you're wanting, or you have to worry about the shortages that can happen, which would put you on back order, all these things. But we don't use animal byproducts mainly because of the risk of there being different contaminants that can be in there depending on how the animal was raised, fed, etc. By using mycelial enzymes as well, we can ensure that we are free of any harmful excipients that we have to use in our product, because animal-based enzymes like pancreatin, your pepsin, your animal amylase, protease, lipases, remember what I said earlier, they cannot withstand the harsh pH of the stomach. They're not near as durable as mycelial. Okay, so similar to how a lot of people are switching to spore-based probiotics because they're more durable than your bacterial strains. Same thing here. Mycelial, by a long shot, are more durable than animal, which is another reason why we use them, because they can work in various pH ranges without us having to add excipients. They're also safe for pregnant women, babies, children. Womb to tomb is what I say. Mycelial and plant can be used from womb to tomb, and it's that wide pH stability that they have. Is it possible to take too many enzymes? It is not possible to take too many, but it is definitely possible to take too few. Another important thing to note about enzyme therapy, and what I love about it, is they're not based on age or weight. You literally cannot overdose. So I mentioned activity earlier. I like to think of their activity as the amount of spins they have. So let's say you have, like our protease, for example, has 600,000 HUTs of proteolytic activity. That's a lot of spins, right? But once those 600,000 spins are done, it's gone. It's either recycled and reused to, as a protein source for the body in some way, or they're when their activity is used up, they're done. They're gone. They don't like build up in your body. This is why when it comes to dosing, you can't just take one a day. You have to take a digestive every time you eat. For the systemic benefit, you take it, ideally every 3 hours, because that's about the time that activity is going to last based on the activity in our product. So this is why it requires that more continual intake versus a one-time dose. Unlike certain vitamins, minerals, and herbs, there are no upper limits, which is really, really nice. I've had infants take the same strength formula as adults, and I've had adults that can't tolerate the higher formulas that an infant might be taking it. There's various factors that go into it, like how toxic they might be, maybe the condition you're working with. Obviously, someone with cancer, I'm going to dose higher. So there's things that you look at. But the cool part is you don't have to be so worried about hurting somebody with them, if that makes sense. So also, the reason you can't really take too many is the body has an estimated 100 trillion cells. One cell can use thousands of enzymes every second, allowing huge quantities without overdosing. Right. And so, as I had mentioned too, their activity is around 1 to 3 hours and then they're eliminated. That's also why you don't have like this buildup where you get toxic levels. So I had already kind of said this about pregnant women and children. Not only can pregnant women and children take them, they absolutely should be taking them, specifically in pregnancy. And I do a lot of talks on this on our webinar series. But in pregnancy, the digestive system is really neglected quite a bit, despite its major importance in ensuring the bioavailability of the nutrients in the body. Supplemental mycelial enzymes ensure the bioavailability of nutrients to mom and babe. They also help to make sure that the womb is not toxic, and I'll show you why a little bit later. But when we aren't digesting properly, we're creating toxicity. And we already know that when we're pregnant, due to the shunt, the digestive system takes a hit because our body is under stress, right? Because we're creating a human being. So digestion is already suppressed. That's why women get heartburn. That's why they get constipation. That's why they get gas. Yes, there's hormonal shifts, but the digestive piece plays a bigger role in all of that. As I said already, they are safe. They're not teratogenic. Dosing depends on need, not age or weight, and delivery depends on the situation. So for example, if you're breastfeeding and you just want to make sure that your body is utilizing your nutrients efficiently to get through that milk, you can take a digestive. Also, though, when I have infants, colic's really, really common. Eczema is really, really common. We start with mom because the child is getting mother's milk. And so when we give it to mom, it also helps support, her digestive system to make sure that there's not any pathogens or undigested components getting into mom's milk that baby's digestive system isn't ready for. If the mom is breastfeeding, yes, I will give it to the baby too, depending on what's going on. So if I have a child, which I work with lots of them, with severe eczema, I'm also going to be dosing the child and mom. It's going to be both because they're way further along in the disease process versus just a mom that's wanting to make sure her baby is getting adequate nutrients and making sure she's taking care of her digestive wellness while she's nursing. I might just give it to mom. When it comes to babies that are on formula or even getting solids, 100% child directly gets the enzymes. And those, we talk about that in webinars I've done. And then you can also schedule time where we can go over application of that. We also carry different blends and lines. So we have, for example, 7 different digestives, right? That's to ensure that we are able to meet the various individualized needs of people because one digestive isn't going to work for everybody. We do have a child's line as well, and I'll talk about that later. Can enzymes be taken with over the counter or with other prescription medications? So digestive enzymes function by breaking down specific chemical bonds in food. Therefore, in most cases, they can be taken safely with medications. Protease inhibitors is a common one that we get. Here's the thing with protease inhibitors. So the inhibitors work on a specific protease, not the ones we use. Our protease are not medicine. When protease is in medicine, it is usually synthetic, and inhibitors are for specific strains used in medicine, not for what is used in our systemic or digestive formulas. So it does not apply to TEC proteases if someone's working with a protease inhibitor. Completely safe to take with those. Do I need digestive enzymes on a raw food diet? So when a part of any living system is removed from its source, it's going to lose some of its vitality. So while raw food does have enzymes that are specific to that food and help our own endogenous enzymes to release some things, there is some thermodynamic energy there. However, it really all depends on the nature of the raw food and the integrity of its structure and how it's been kept maintained, how it was harvested, etc. So, for example, some cells die, some structures lose their integrity, and some molecules lose their functionality and or become very susceptible to degradation, especially after harvest. So not all enzymes, another thing is that not all enzymes found in raw foods are hydrolytic in nature. So they're not necessarily functional to perform full or partial digestive hydrolytic function. So that basically means, you could eat that bell pepper and have enzymes for the bell pepper, but it's not going to help you with digesting anything else. And, most plants don't contain enzymes like cellulase, hemicellulase, xylanase, and others to help us readily digest the different components of that plant and that could create more digestive distress in people. Why do enzymes sometimes cause constipation? So some who take enzymes often complain of being constipated after a few days and wonder if it's the enzymes that are causing it. So it's really not. All enzymes do is they break food down thoroughly so that more food is absorbed and not passed out as feces. So we don't have like that dumping syndrome. A lot of people actually have undiagnosed gallbladder issues, which is creating a false bowel movement. So we like to make sure that a patient is taking their protocol properly, drinking enough water and getting enough fiber in addition to taking their enzymes to ensure that they're having a regular bowel movement and it's not just that bile dump creating that. But when you're bringing enzymes in initially, the enzymes, because of their ability to break foods down more efficiently, if someone's been malabsorbing the whole time, now that their body's utilizing those nutrients, you're not going to probably dump or have as many bowel movements. Over time, that starts to correct itself, but it can take a couple of weeks as the body's adjusting and the digestive system is adjusting to the new support that it has. So like when that happens, if someone does get temporary constipation when they start the enzymes, what we typically recommend is to, definitely, like I mentioned, get the water and the fiber in, and then we make sure that a probiotic is also added in there to help support regular elimination daily. We also have a support product that Vitaboom carries called Release-Zyme that can help and be used temporarily to help stimulate peristalsis while the the digestive system is adjusting to the enzyme supplementation, but they don't directly cause constipation. It's typically because better nutrient absorption. So you're actually able to absorb and the body's going to build those better bowel movements, or it is because of the gallbladder. And now that we're giving enough lipase, we aren't having that bile dump, which was what was actually creating the bowel movement the whole time. Okay, gas and bloat after enzymes. So bloating or gas after taking enzyme supplements is really usually the result of our digestive system, as I mentioned earlier, reacting to the new enzymes entering the system. So this is especially true if you've been abusing your digestive system with an unhealthy diet and lifestyle. This results in undigested matter gradually clogging the lining of the intestinal walls. And as new enzymes are introduced, they begin breaking down that undigested matter, creating extra gas. So it's really ironic that one of the key causes of stomach bloating or excessive gas is lack of enzymes in the body. However, after many years of being deficient, you need to have patience because the body requires time not only to adapt to those new enzymes that you're taking, but also to relearn how to digest and eliminate waste properly, as it will have been hampered due to the bloating, et cetera, that happened. Usually takes a couple of weeks and then it will resolve. So for example, when people have bloat gas above the belly button, we usually will recommend Digestyme. Below the belly button, we'll recommend Gastrozyme. And then the last thing I want to kind of cover is the why. Why do we need digestive enzymes? So our bodies naturally produce digestive enzymes, and the enzymes that run our metabolic process. However, genetics, lifestyle, diet, processed food, prescription drugs, and environmental factors all influence digestion on a daily basis. They also influence our ability to rid the body of toxins. So poor digestion not only impacts nutrient status, but it also adds to the toxic burden. So I've shown the ripple effect, or I haven't shown the ripple effect. We'll show that. The fact of the matter is that toxicity is a driver of most disease, and we are simply exposed to too much for the body to keep up. So the graphs you're seeing here are from our latest research study on the role of enzymes in detoxification that validated that diet alone is not enough. This was the first study of its kind investigating the role of proteolytic enzymes in detoxifying the body. You can view the full study at mycliniciantoolbox.com, or you can email me for a direct link to it at clinic@tecenzymes.com. We also had Dr. Bastidas, our lead researcher that conducted this study, do a full webinar on it. So all that can be found on the Clinician Toolbox. But the gist of it is, there's a lot of people that say food is the fix. Dr. Mark Hyman says that. And I love that phrase. I love that quote, but it's not the complete fix because this study validated that. These people were on, we had a diet, plain protease. So they were all on the same diet, all organic, grain-free. So technically, the number one glyphosate would be grain. We had that out. They followed our Thrive program basically. So same diet, all organic. One group, however, had enzymes in place, the other did not. And so in that study, you can see the full breakdown of the toxic output scores. And it's pretty remarkable what the enzyme group was able to do versus the non-enzyme group. Now, we've gone through some of the most common questions and myths about enzymes, allowing you to feel more confident when implementing them into your patient protocols. However, if you're not sure of the why, the answer is really simple. All disease begins in the gut, and all health also begins in the gut. So it just makes sense to start there. When you don't digest, right, the cost of poor digestion is nutrient deficiency, right? So if you're focusing on hormones, we know that the body needs nutrients to make hormones. If your focus is cardiovascular, same thing. Literally every system of the body needs nutrients. Nutrition is the key to a lot of it, right? Food first, right? Digestion second. When we don't digest, that leads to cell death because the cell is not getting the nutrients it needs, right? Dysbiosis can occur. When we aren't digesting, it increases burden on our pancreas. It increases burden on our liver. It sets us up for conditions like leaky gut. It dirties our terrain, which makes us really susceptible to all types of disease, including cancer. It also creates dirty receptors. So you work in hormones, guess what? Poor digestion is part of your solution, right? You have got to address the digestive piece because poor digestion means dirty receptors, even for your hormone receptors. So I love this image. This is that ripple effect. Digestion, nutrients are supposed to be the right food, so you get nutrients to repair the cell and achieve wellness. However, when you don't digest, you get toxicity, inflammation, and illness. So whether your approach is food first, vitamin and mineral supplements, postbiotics, etc., the reality is you are not what you eat, right? You're what you digest, assimilate, and fail to eliminate. Poorly digested carbohydrates will ferment in your colon. Poorly digested fats will turn rancid in the large intestine. Poorly digested proteins will putrefy. What this does is it creates toxicity that creates inflammation. And we know inflammation does what? It creates disease. So if you truly want to be a practitioner that prides yourself on root cause solution and getting to the root, peeling the onion all the way back, you got to start here, guys. You got to start with digestion. And with that, and this was the aha I had as a practitioner back in 2017, it doesn't have to be hard. It really can be very simple. It's as simple as give the body the nutrients it needs, clear away the waste, and allow the body to manage its resources. So how do you do that? If you're wanting to change and simplify how you practice and really start at the root of where most issues in the body begin, this foundational approach has been clinically proven time and time again, over and over the last 30 years to work. And really, I kind of just use these main three, and I'll bring in stuff here and there. Digestive support in the form of a digestive enzyme is the most efficient way to stay ahead of toxicity and support the pancreas. Remember, just because you're eating it does not mean your body is utilizing it. A digestive before meals also supports additional therapies you might be utilizing due to its ability to enhance nutritional precursors and mitigate toxicity. The systemic support that you get with the proteolytics is non-negotiable, right? That is honestly a desert island product for me. Taking a protease between meals supports not only blood flow, but also detox, inflammation control, and immune modulation. And who doesn't need that on a daily basis? And lastly, probiotic support. We need this to ensure that the microbiome parking lot is constantly being reintroduced to good bacteria and ensuring that what we're eating is not only being digested, but that those byproducts and toxins are also being eliminated on a daily basis via the colon. So this is our foundational approach. When you look at our protocols, you'll notice that every protocol has a digestive in place, a proteolytic in place, and a probiotic. But we're more than just an enzyme company. So we do specialize in enzymes, but we're more than that. We know that digestive and systemic enzymes play a huge part in any healthy protocol, but they're not always the complete solution. And this is why we provide additional support products for each system of the body that may need some help. But also our products work really well with other products that Vitaboom has that also will help increase the clinical efficacy of those, because remember this ripple effect. So if you're using things like, glutamine or whatever, maybe it's a stress support product, by making sure that the trunk of the tree, another analogy would be thinking of the body as a tree. If the trunk of the tree, i.e. the digestive system, has holes in it, is broken, it has an algae on it, guess what? The nutrients from the soil are going to be blocked. They're not going to get up there. So, I think of lifestyle and diet as our soil, the digestive system as the trunk, and the other systems of the body, cardiovascular, nervous, endocrine, that's your branches. You got to make sure that trunk is functioning optimally. So even if your primary approach isn't enzymes are going to help to facilitate whatever approach you're doing because of their ability to clean all that up for you. So the next few slides that we're going to be going over are the other products available on Vitaboom that you can use to incorporate into your prescription packs. But before we do that, I do want to show you how to decipher the various products that we have that are in the same category. So all of these aren't on Vitaboom, but I just wanted to have this here to show you guys. So at Transformation, we have what's called a sensitive line and a therapeutic line. So a lot of our products that have this turquoise label, like you see here, with this TPP emblem, that's what that is a TPP. Hopefully y'all can see that. That stands for Transformation's Professional Protocol. These are our stronger, more therapeutic line. So these we really do encourage to be taken under the supervision of a practitioner, or if they're not working with a practitioner, they have to actually do a consultation with me so we can kind of go over all the things to expect, etc. But for the sensitive individual, we have what is called the Zyme line. Any product at Transformation with a purple banner and a butterfly, and typically will end in the word Zyme, means it is a sensitive product. It's the sensitive line. We have more than one digestive. We have, these various ones here. So if in determining, especially when you go to your Vitaboom account, If I go with digest or digest-zyme would be your gentle digestive. The turquoise is your more therapeutic. They are not identical formulas. I will show you here in a minute, but I did want to have this here so you guys can see that outside of a digestive, a systemic, and a probiotic, we have other support products. First one being our cardiovascular support product. This is lipo. It is available on a Vitaboom. I love this product. It is a therapeutic formula to help with any imbalance of the cardiovascular system, including managing cholesterol levels, managing lipoproteins like your LDL, helping with triglyceride levels. It's also great for blood pressure. It contains chromium to assist in the control of blood sugar imbalances. It has enzymes in there. The enzymes that are in this product are not in there as a digestive. So it's not like you would take this as your digestive. Remember I said at the beginning, we have enzymes in every product to ensure that the different nutrients in our products, whether it be an herb or some form of vitamin or mineral, is to ensure that the body is able to appropriately utilize those ingredients in the most efficient way, which allows us to not have to use as much per milligram wise when it comes to herbs and different things, because that also comes into tolerance. A lot of people can't tolerate high doses of herbs. So with our products, what I really like, especially because I work with kids, the dosing of or the amounts of the other ingredients that are non-enzyme based are so much smaller that they're tolerated much better. This product also has gugu lipids and various herbs to help support lowering cholesterol. It has a wonderful antioxidant blend to support free radical damage. It's also vegetarian and with no fillers as well. So love this product for dosing guidelines. I'll get to that in a moment. Our constipation product, for those with chronic constipation, this herbal enzyme blend is gentle but effectively useful at jump starting a sluggish colon and taking the burden off of bowel toxicity. That also helps to support the immune system, kidneys, lungs, liver, etc. It does have enzymes in it as well, as you can see here, to ensure the facilitation of these ingredients. The herbs in here are known for their ability to stimulate peristalsis, absorb moisture, and provide bulk to the colon. So that's the release sign formula there. It works great, not habit forming, does not dehydrate. It doesn't cause diarrhea. It just creates a better bowel movement. And if there is constipation, because of its ability to bring in moisture, it does make that stool more, not liquid, but softer, if you will. The next is our detoxification support products. We have our liver support first. We know the liver plays a huge role, not only in digestion, but also in hormone regulation and detoxification. This formula promotes optimum liver function by removing embedded toxic materials and supporting normal regeneration sequences. It has antioxidants that we're all probably pretty familiar with when it comes to supporting the liver and support that hepatic cell regeneration. Specific herbs known for their benefit on liver health and detoxification. It is a vegetarian product as well, so safe to take. Regular maintenance would be like 1 cap, and then more therapeutic would be 2 or more, which I'll talk about that a little bit more. This is also just showing you where you would maybe want to bring this in, but a great just everyday, even maintenance product to take. If you did like an extensive, maybe you're using a detox protocol through Vitaboom, and then you need to know what to do for maintenance. This is a great maintenance product to even bring in just for general liver health. Then we have our other detox product. I love L-Drain. It assists, this is a liquid, which is nice because you can also, it's not another pill you have to take. I put it in my big water jug every day, 3 times a day, and drink through it. It doesn't have a taste. This product assists in eliminating waste from the lymphatic system and has a unique blend of herbs that are beneficial for relieving congestion of the interstitium, which is also going to improve your nutrient absorption and enhance immune function. It has, it's formulated with red root, red clover, prickly ash, and salingia root, which is they're all shown to remove toxins and improve circulation and drainage within the lymphatic vessel. What I like about it too is it helps to address the internal lymphatic system that you can't always get to with external techniques like dry brushing or hot cold showers or sweat exercise, right? It gets more of the organ piece in. Then our digestive support formulas. So this is a core, right? Everybody to me should have digestive enzymes as a first line defense in their practice. I would say that if I didn't work for Transformation, because that's how much it has shifted my practice and my clinical approach. But digestive support that Vitaboom offers you guys, they carry our digest, which is our strongest digestive product and one of the best I've seen on the market. Per capsule, this is what you get. So if you're using somebody else, check out that capsule amount, because I've yet to see somebody per capsule have this amount of activity in there, which when it comes to quality and cost, that's stuff to look at. Oftentimes the cost per capsule for us is lower because our activity is so much higher per capsule. So you can see that we are covering you all the way through. We have a various blend of proteases, acidic proteases and alkaline, not just alkaline, because you need both for digestion. We have a high amount of lipase here, and our lipases do not require bile to work. So you might be looking at this wondering where the ox bile is. I do a whole webinar on that too, but our lipases do not require bile, and we are also not a need-to company. So if there's not a clinical need, we do not bring it in. At the time of this formulation, ox bile was around, but the quality was not great. Ox bile also requires enteric coating. I think now they have options that don't, but you have to remember at the time it required enteric coating. We don't use enteric coating, so we went with the lipases that can work without bile being present. And in our almost 40 years of doing this, we have yet to find a need to have to bring it in, because it works well without having to use bile. Not to say that you can't use it with bile. You can. We have people that use TUDCA and things in conjunction with this, completely fine, because the bile is only doing one small piece of digestion. That's something to always remember. And if one part of digestion is struggling, the rest probably is too. So it just makes sense. And then you can see it has a very in-depth polysaccharidic blend here, 12 different polysaccharidic enzymes to make sure you're digesting all the different forms of carbohydrate, starch, sugar that would be coming in the diet. Great product for those with SIBO, candida, etc. Then there's the Digest-Zyme. So remember, turquoise is therapeutic, stronger, purple is gentle, butterfly, sweet little butterfly. Notice the difference just in the enzyme amount. This is our mother product. This is the product that launched Transformation. It's very effective. It's a phenomenal product. It's a great starter product if you're not sure if someone's going to be sensitive or not, but it doesn't have as much polysaccharidic. The lipase isn't as high, but what you'll notice, like for example, see here, the cellulase is much higher. So maybe someone that's been on a standard American diet for a very long time, not a lot of fiber. What's going to happen when you start pushing lots of fiber on somebody that's never had it? They're probably going to have some digestive distress, bloat, gas, etc. So this might be a good one to go with because of that cellulase. And these are things that we can talk through in what we call a clinical alignment, which I'll talk to you about a little bit later. Another great digestive that Vitaboom has of ours is the Carbo G. Well, I say this about every product. I love this guy. I love this one though, because this one's really cool because it can work as like a 3-in-1. It can work as a probiotic, prebiotic, and a complete digestive, because you have all your polysaccharidics here. You have a high profinity of proteolytics here, including DPP4, dipeptidopeptidase, which is the proteolytic enzyme that is the most efficient at degrading the gluten encasing molecule. It has the lipase for your fat. Like I said, all the carbohydrates here. Then you have the herbal blend of fennel, ginger, flax, peppermint, artichoke, and then probiotic. So the fennel, the flax, the artichoke, there's your prebiotic. Then you have your prokinetic aspect to this with the peppermint and the ginger, right? And then you have probiotics. So where I really like to bring this one in, me specifically, if someone's on a budget or has pill fatigue, doesn't want to order a whole lot of different products, I might just go with this guy, because something's better than nothing, right? So I'm getting a little bit in, and they're taking it, I'll dose them 2 caps 3 times a day. That's going to get them up to pretty much 1 billion of the B impetus, right? It's going to get them, sufficient amounts of this to help with that prokinetic prebiotic aspect. And then they have the enzyme. So great product. You'll notice though, the lipase is a lot lower than digest. So might not be your best bet for somebody on keto, right? But paleo, general, or it really could go across the board. So another really, really, really great option. We market it as our gluten sensitive or gluten intolerant product, but it can be used as a general digestive as well. Then there's our GI lining support products on Vitaboom, our Gastro and Gastrozyme. The Gastro, again, remember, this is the therapeutic, more professional. This is the sensitive. They will do the same job. Just one is stronger. I mean, you can look at the label and see there's a lot more in Gastro than there is in Gastrozyme. But both will do a really good job at addressing things like indigestion, gas, burping, that below the belly button issues, diarrhea, ulcers. But what this also serves as is GI lining support. It will not only provide support for the GI lining, but it also provides support for the respiratory lining, mucosal lining, because we have mucosal lining in our respiratory system and our urinary system. It supports all of it. So even with like UTIs or respiratory infections, you can bring these guys in to support that lining. It's really there to just soothe the GI or any of those linings and provide comfort. It has enzymes like all of our other products to enhance the bioavailability of the different herbs in there. It has, let's see here, it also has antioxidants to combat the free radical damage that we can see. So tolerated very well. So yeah, there's those. Let's see here. Then our Masterzyme product. This is our complete endocrine support product. This is not vegetarian because it uses glandulars, but shocker, I love this one too. I really, really do. It's been phenomenal for helping me get through perimenopause. But Masterzyme is great because it uses those glandulars. I've not seen anything like this on the market with this blend of glandular support. You have thyroid concentrate, you have suprarenal cortex, you have anterior pituitary that's not a glandular. You have your gonadal substances. So this is for men and women. And then you have the different nutrients that support all those glands. So if you're looking for pre, post, general, just endocrine support, pre-menopause, post-menopause, issues with, prostate, et cetera, this is a great guy to bring in. Also great for even helping with fertility. So excellent product. Love this guy. Then we have our inflammation and detox formulas. I'm kind of going to go faster because I'm really running over. These are all of our proteolytics that are offered via Vitaboom. So as I said, we specialize in enzymes. So we're not just going to have one systemic, just like we're not just going to have one digestive. So we have various systemic options. In a nutshell, this is our strongest, not only our strongest systemic, it's the strongest I've seen on the market thus far. It has over 600,000 units of proteolytic activity. This is the one that we are also doing the most research with right now regarding cancer and autoimmune disease. We have a whole workshop that we're doing next week actually on that. If you'd be interested, I can give you more info. But this proteolytic blend uses mycelial and plant-based enzymes, specifically bromelain, which is a blend of different proteases. Super effective. What I love about it is it kills so many birds with one stone. It's going to support circulation. It reduces inflammation, removes toxin, spike protein detox, wink, wink, and then, other various things. Now, the differences here, though, is the Purezyme compared to protease. Purezyme is also a just proteolytic product. It's a systemic, and systemics are meant to be taken away from food. I usually have people do rise, midday, and at rest. This one is not as strong as far as the proteolytic activity, and it is also using a different blend of proteases. This one's using about 6 different proteases. This one only uses one. It's protease 4.5. What's nice about this one, though, is how well it is tolerated. You'll notice, too, that the calcium citrate is listed here versus on this one, it's down here. This calcium citrate is not an added ingredient. The only reason it is in this product, and really in our systemics in general, is for tolerance. The calcium citrate serves as a buffer. So this is what makes this one so nice for the sensitive individual. In our leaky gut study, as well as in our leaky gut program, we typically start people with the gentle first because they're pretty toxic and we don't want them to hurt. So we'll go with the gentle line first. Then we have our IFC. It's unique in the fact that it does have a high amount of proteolytic activity. I think there's around 300,000 in this one when you total it all up. But what's cool about it is it's using a multifaceted approach by also bringing in antioxidants in the form of vitamins and minerals, as well as different herbs. So you can see it has, your kelp, your Irish moss, your CoQ10, it has green tea, it has turmeric, Asian ginseng, glutathione, all in one capsule versus you having to take a bunch of different ones. You can see it has selenium, zinc, etc. This one I really like to bring in for acute inflammation and injury. Great to use with autoimmune as well. But proteases, think of proteases like your daily staple. And then IFC you kind of bring in as needed if you would like. Then our probiotic formula that Vitaboom offers, it's becoming actually one of my favorites that we carry. And Transbiotic was actually formulated with both bacterial and spore strains of probiotic to provide the perfect balance for the garden, with an innovative prebiotic developed to support the growth of healthy bacteria in the gut through a non-fiber starch-based approach. So when it comes to the uniqueness of the blend of probiotics, we blended spore and bacterial probiotics. And the reason we did that is because it offers a synergistic approach to gut health, leveraging the unique strengths of each type. So Bacillus subtilis is the spore that's in this formula, and it has increased resilience to stomach acid and can survive harsh environments, ensuring that more bacteria reach the small intestine. Whereas bacterial probiotics in here, like the Casey, the Plantarum, and the Acidophilus, they're more active. They can be more active and quickly populate the gut, contributing to a balanced microbiome. So this combination leads to a more comprehensive and beneficial gut microbiota. But the coolest part of Transbiotic to me is that we use an alternative approach to food-based prebiotics. Most prebiotics for the gut require an oral dose of about 3 grams per day or more to give you any type of benefit. And we know that with large amounts of prebiotic, while effective, it can result in complaints of gas, bloat, and discomfort, even environmental sensitivity. So since fiber or starch-based prebiotics can limit tolerance of a probiotic in some individuals, alternatives in the form of bacteriophages for prebiotic benefit can be used. And that is what we used here. We used highly specific bacteriophages to serve as the prebiotic. And the way they work as a prebiotic is that they enhance the growth of beneficial bacteria in the GI due to their ability to inhibit the growth of neutral or potentially harmful bacteria. What this does is it creates an availability of space and resources to allow the growth of beneficial organisms. It also has a delayed release capsule, which increases intact delivery to the small intestine by protecting these organisms from stomach acid. And because the primary strain is Bacillus and the strains of Lactobacillus that we're using from the bacterial families are very durable, it does not even require refrigeration. We market it kind of as our travel probiotic, but it's a great just everyday if you wanted to, but it is nice that you don't have to refrigerate it and it still meets label claims. So like I said in the beginning, because we're telling you how much is in here, we have to make sure it meets label claims. So at the time of expiration, to ensure that we're meeting that label claim, we actually can overfill up to 10% to make sure that all the probiotic strains are still live at the time of expiration. And that goes for our enzymes too. Then we have our sleep and anxiety formula Calmzyme. This helps to reduce the physical effects of stress. It's an herbal and enzyme blend that is going to feed and fortify the nervous system. The name, as it says, it implies a calming. I take 3 every night before bed. It helps to slow mental chatter, and it also helps with anxiety and insomnia. It contains valerian and skullcap, which we know have compounds that promote calmness by increasing our GABA. It has hops, which is classified as a nervine, which is an herb that soothes the nervous system. And then it also has wild lettuce, which aids in relaxation and has been found useful in the treatment of insomnia and anxiety. And then we have the difference here. If you're already using these, remember that enzyme delivery system. Then our Rezen, this is our kind of stress cortisol regulated product. It's ideal for a natural approach to stress because of its ability to feed and fortify the nervous system as a whole and help with cortisol regulation. It produces its calming effects by supporting a healthy cortisol level and balance within the autonomic nervous system by using a blend of different stress and brain optimizing nutrients like B6, amino acids. It has neuroprotective herbs and enzymes, and it's also considered a neurotropic or nootropic, which is a cognitive function enhancer. It does contain GABA for anxiety. It has ashwagandha, which is a natural cortisol reducer and neuroprotector, as well as L-theanine, rhodiola, and bacopa, which also provide additional relaxation and stress support. So love this, guys. Common theme here. All right. So as we're wrapping up, as I mentioned in the beginning, we are clinically founded and owned and operated. And that's how we've been able to develop over 100 clinically tested protocols using enzyme therapy and the various products I've discussed in today's webinar. So in order for you to access those protocols, as well as our practitioner application guide on how to dose and create your Vitaboom packets with the right dosing, you can visit mycliniciantoolbox.com and you will find what is called our practitioner reference guide. So this reference guide is going to give you not only when to clinical qualifications of when you could use it, but also the dosing, therapeutic dosing, because what you see on the bottle is just FDA standard. Also, though, what's really cool about the toolbox is this is home to all of our education. You will not find any education that we offer on our actual website. This is a complete separate website. We have to do this for FDA purposes. So if you go there, you can also view all of those protocols I just showed you. You can view our research papers, including the one I mentioned earlier. You can view our articles, case studies, product reference guides, product rationales. It's also home to our education series, our monthly free webinar series that we offer, as well as our purchasable education like our Enzyme 101, our body typing course, and our upcoming workshop on the influence of enzyme therapy on pain, cancer, and autoimmunity. That's not only going to be highlighting what we're seeing in our research, but sharing the case studies as well, and those most recent findings, which are pretty remarkable. And if you're not sure on which product to take, as a partner of Vitaboom, we are happy to also offer all Vitaboom practitioners support through a clinical alignment. And what that is you can connect with me directly, and we can talk through the products that you're putting into your Vitaboom protocols from Transformation and determine what would kind of be the best one to go with if you're not sure. So those calls are really helpful to help you kind of navigate where to go as you're kind of getting the groove, and especially if you're new to Transformation or using these types of products. And as a special offer to all Vitaboom practitioners, we are providing you guys with 10% off any education you would like to purchase through Transformation Enzymes. So if enzymes are something that you're dabbling in but really want to be more comfortable and learn more, you can absolutely use that code and purchase our Enzyme 101 course. The advanced certification course is a comprehensive 16-hour training, and you can self-report 16 CEUs with that. We also have our body typing course, which can equate to 5 CEUs. And then the one I'm most excited about is our upcoming virtual workshop. This is a virtual workshop that will be recorded, and you can submit for 7 CEUs with this workshop. But the workshop itself is covering 7 signs of a healthy gut, the influence of enzyme therapy on pain, cancer, and autoimmunity. You can, again, contact me directly, go to my clinician toolbox, or sign up and view the full curriculum for this workshop at tecseminars.com. Be sure to enter that Vitaboom code so you can get 10% off the cost of that workshop, which is already, to me, a really good value anyway. Okay.
Oh, hey, Amy. You disappeared for a second. Thank you so much. That was awesome. Such good information. And I just wanted to close out to let everyone know, if you're adding some of the Transformation Enzymes, or you want to add some of the Transformation Enzymes products to your Vitaboom protocols, if you don't see a specific product that Amy went through today in the presentation in our catalog, just reach out to. If you have any questions about how to add these products to protocols, like Amy said, she's available for additional consultation and information. All you need to do is just reach out to us at support@vitaboom.com, and we'll get you taken care of. All right. Thanks so much. Thank you, Amy.
Thanks, Deborah. Bye.